Hello, it's Dr. Rhonda Johnson. Today's Sunday, February 16th, 2025, and today I'm talking about carpal tunnel syndrome. Now, it is a common condition. It affects between 1 to 5% of all adults in the United States, and it's caused by a compression of the median nerve in the wrist that leads to the palm, and it causes symptoms such as tingling, numbness, pain, and weakness in the hands and the fingers. These symptoms are often worse at night. Now, the diagnosis can be made based on the clinical symptoms and exam findings. Now, folks, I'm going to get a little personal. It's a condition that I am very familiar with for the past decade. I've had these symptoms and tried to go through conservative therapy, but then I had a diagnostic test, electromyogram, EMG, which showed I had severe carpal tunnel syndrome, and I'll talk about the surgery that I had. So what about the risk factors? Well, age is one of them. People between the ages of 40 to 60 are more susceptible. Women are more likely to develop carpal tunnel syndrome, and it's said to be possibly due to anatomic features such as a smaller carpal tunnel area. That area has to house 9 flexor tendons and the median nerve. And then there are conditions, medical conditions like hypothyroidism, diabetes, heart, kidney disease, and a history of a recent fracture. Then there's repetitive wrist movements such as computer typing or assembly line work, which can contribute to carpal tunnel syndrome development. So how do you prevent this? Well, ergonomic adjustments for your work environment or at home, maintaining your wrist in position, stretching your hands often, and doing wrist exercises such as gentle strengthening and stretching to help reduce pressure on the median nerve, and overall health, managing your underlying health conditions. Now, one thing I didn't know that obesity can double the risk of carpal tunnel syndrome. So what about treatment? Well, you first want to do all the conservative things like wrist splinting, especially at night to keep the wrist in a neutral position. Sometimes non-steroidal anti-inflammatory drugs to alleviate pain and reduce inflammation are used. Some people have had corticosteroid injections to decrease the swelling and relieve pressure on the median nerve. Physical and occupational therapy can help as well. But if you get to the end of the line like I did, then there's surgical treatment involving carpal tunnel release surgery. It's recommended for severe or persistent cases. This procedure involves cutting that transverse carpal ligament to enlarge the tunnel and reduce the pressure on the nerve. Now, this is important because you want to get your diagnosis and your intervention early because you can have significant relief with appropriate treatment. However, if it progresses or if it's left untreated, it can lead to permanent nerve damage and muscle atrophy and neuropathy, resulting in lasting functional impairments. So if you're experiencing symptoms of carpal tunnel syndrome, please see a healthcare professional and get a personalized treatment plan that is right for you. I, again, had surgery 4 days ago. I'm well on my way into my recovery, and I hope to be fully back in business in a couple of weeks. Take care, folks, and be well.